Before the client enters the room for their pelvic examination, ensure that you have created a safe and respectful physical environment, which includes positioning the exam table away from the door, verifying that privacy measures are in place, ensuring appropriate lighting. Strive to provide client-centered care using a sensitive approach. Be ready to discuss the range of choices offered to clients. Verbalizing a description of the examination process, positioning the examination table, options to have a support person or a chaperone, options to use a mirror to see the procedure. Make sure that you are familiar with the equipment available so the client can position themselves in a way that feels most comfortable for them during the examination. This could mean adjusting the angle of the table, offering an extra pillow, allowing them to choose the position that makes them feel most at ease. Allowing the client's head to be elevated also allows for easier eye contact between the clinician and the client during this sensitive procedure. It's important to ask the client about their preferred preferences and accommodate them as much as possible to promote comfort and dignity during the examination. Something that can make the pelvic exam easier and less traumatic is the use of inclusive and respectful language. This means using terms like insert instead of stick in, remove rather than pull out, referring to the examination table instead of a bed, and using footrests instead of stirrups. Ensure to describe findings as healthy or normal rather than good. As always, it is important to provide non-judgmental care, avoiding assumptions about clients' identities and experiences. Demonstrate cultural sensitivity and encourage open and honest communication throughout your interaction. You must also ensure that you are properly prepared. Having all the necessary supplies ready before the client arrives prevents having to leave the room and leaving the patient in a vulnerable position. Once your side table has been sanitized, lay a drape on it and arrange your supplies in a way that will allow you to easily access them one-handedly. Typically, the following equipment is needed for a pelvic examination: exam gloves, mirror, fixative spray, liquid-based cytology, cytology broom, cervical spatula, cervical brush, large swab, cytology slides, culture swab, lubricant, speculum, headlamp, and a nucleic acid amplification test, or NAT. Once your supplies are ready, lay a second drape over them to keep them hidden from view. This helps avoid causing the client any undue stress. Lastly, ensure the table is positioned on your dominant side at the foot of the examination table, within arm's reach. Remember, all these preparations are done to ensure the client's comfort and the procedure's efficiency.